What vaccinations are important to receive?
I'm just going to give you an all across the board answer here and say that they're all important, because if we can prevent a horse from getting a disease, no matter what type of disease that is, if we can limit their exposure or give them protection against that exposure, then that's ideal for any disease. The most important ones that we vaccinate against are probably, above all everything else, is rhino or equine herpes virus. It's common in horses. There's several different types of it. The main ones that we vaccinate against are types 1 and types 4. And equine herpes virus is a reproductive malady, but it can also cause respiratory problems, it can cause neurologic issues, and it can also cause death, especially in young horses. So it's very important to vaccinate both pregnant animals and young horses against equine herpes virus regularly.
What vaccinations do you give here specifically?
There's about 9 or 10 different things specifically that we vaccinate against. As I mentioned already, equine herpes virus or rhinovirus is one of the most important ones that we give. We also vaccinate against Eastern and Western encephalomyelitis, tetanus, West Nile virus, botulism, rotavirus, flu.
Is there a specific time of year for certain vaccinations?
There are. Especially with the pregnant mares, we vaccinate pregnant mares according to how far along they are in pregnancy, so that depends on the time of the year. We also try to vaccinate for West Nile virus in the spring and also again in the fall. Rhino, we vaccinate every horse regularly in 90-day intervals. Sometimes more often than that. The foals we vaccinate against rhinovirus at least 6 times during their first year of life. And barren mares barren mares and foaling mares that are going to the breeding shed are required to be vaccinated against equine herpes virus, as well as horses going to any type of sale. And they have to be done within usually a 60-day window of the time that they leave the farm to go either to the breeding shed or to the sale ground.
How often do you give certain vaccinations?
It depends on the horse, it depends on the age, and it depends on what we're vaccinating against. Foals and yearlings get vaccinated often, at least every other month, sometimes once a month. Pregnant mares get vaccinated in their 5th, 7th, 9th, and 10th months of pregnancy, and that's mostly to combat equine herpes virus. And in general, adult horses that are not used for breeding stock get vaccinated 4 times a year.
Is there anything about vaccinations that you feel beginners should know?
One of the more recent vaccines, the rotavirus vaccine, it's only come on the market in the last 10 or 15 years, and we give that to every pregnant mare, and it seems like it's been very effective in reducing the rotavirus in foals, which can cause severe diarrhea, and it's just a disaster. We've noticed a huge decrease in rotavirus since the vaccine has been on the market and has been utilized. Another thing to say about vaccines is they're not always effective. You can vaccinate a horse against something and they can still get it. But if you don't vaccinate a horse, it has 0 chance against that disease. Even if you're only increasing your chances a little bit, it's worth it to give that vaccine, even if it's not 100% effective, and no vaccines are 100% effective.